Let us cover the OSPE of the stomach in just 1 minute. So stomach is present in the epigastrium and the left hypochondrium, and there are the two surfaces of the stomach. This is the anterior surface, whereas this one is the posterior surface of the stomach. And if we talk about the borders, there are two borders. This one, which is called as the lesser curvature, and this one, which is called as the greater curvature. And if we talk about the ends, this one is the cardiac end, and it has this cardiac sphincter. Beside this, in the pyloric end, this one is the pyloric, and here the pyloric sphincter will be present. And there are the four layers. This one is the mucosa, which consists of the rugae. Second is the submucosa, which is not visible in the model, and the third layer is the muscularis, which consists of the muscle. If we go from outward to inward, these are the longitudinal muscles, these are the circular muscle, and these are the innermost oblique muscle. And this layer is called as the serosa, which is most properly visible on the posterior surface. Whole of this is the serosa. And if we talk about the arteries, on the lesser curvature, the two arteries present, there are two arteries which are present, and this is called as the left gastric artery, this is called as the right gastric artery. Along the greater curvature, this artery is present, which is called as the left gastric epiploic artery. This is the right gastric epiploic arteries, and these are the short gastric epiploic arteries. And remember that this is the fundus, this is the body, and this is the pyloric part of the stomach. Let us cover the model of the liver in just 1 minute. So liver is present in the right hypochondrium and the epigastrium. This one is the anterior surface, this is the superior surface, this is the posterior surface, and this is the inferior surface. This is the right lobe, this is the left lobe, and this is the fissure for the falciform ligament. This is the coronary ligaments, and on the tips, this is the right triangular ligament, and here the left triangular ligament will be present. This is the bare area, and this one is the caudate lobe, this one is the caudate lobe, and this is the ligamentum teres, this is the ligamentum venosum. This is the gastric impression of the stomach, this is the tuber omental, and this is the gallbladder, and this is the inferior vena cava. Whole of this is the porta hepatis, which consists of the portal triad, which is made up of this one. This is the portal vein, this is the bile duct, this is the hepatic artery. This impression is this is the renal impression for the right kidney, this is the colic impression for the right colic flexure, and this is the suprarenal impression for the suprarenal gland. Let us cover the OSPE of the kidney in just 1 minute. So kidneys are the retroperitoneal organ. They will extend from the 12th thoracic vertebra to the 3rd lumbar vertebra. They are present on both the side of the vertebral column, and the right kidney is the slightly left, and the right kidney is slightly lower than the left kidney because of the presence of the liver. So if we talk about the internal structure, this is the renal cortex, which consists of the convoluted tubule. This is the renal medulla, which consists of these pyramids, and also consists of the collecting tubules. This apex of the pyramid is called as renal papilla. The collecting tubules will open here, and renal papilla in the renal papilla, and the renal papilla will open in these minor calyx, which are 8 to 12 in number, and the minor calyx will open into the major calyx, which are 2 to 3 in number, and major calyx will open into this renal pelvis, and the renal pelvis will continue as a ureter. And if we talk about this hilum is present on the medial side, from where the renal artery will enter and vein and ureter will exit. So most anterior structure is the renal vein, then we will have the renal artery, and the most posterior structure will be the renal pelvis. This is the suprarenal gland. And if we talk about this one, this is the upper pole of the kidney, this is the lower pole of the kidney, and if you put your finger here, you will feel the prominence of the renal vein, so it means that this is the anterior surface. And if you put your finger over here, you will feel the prominence of the renal artery, so this means that this is the posterior surface of the kidney. Thank you so much for watching, and best of luck. Let us cover the model of the pancreas in just 2 minutes. So pancreas extend from the concavity of the duodenum in the epigastrium to the hilum of the spleen in the left hypochondrium. This is the head of the pancreas. Head of the pancreas is present in this concavity of the duodenum. This is the first part of the duodenum. This is the second part of the duodenum. This is the third part of the duodenum, and this is the fourth part of the duodenum. This is the uncinate process, and this is the inferior pancreatico-duodenal artery. This is the superior pancreatico-duodenal artery, and this is the portal triad, which is formed by this portal vein, and this in green color is actually the bile duct, and this in red color is the hepatic artery. This is the neck of the pancreas, always remember that at the neck of the pancreas there will be the origin of the superior mesenteric artery and the portal vein. So this is the superior mesenteric artery, and this is the superior mesenteric vein. This superior mesenteric vein will combine with this vein, which is called as the splenic vein, and both of them will combine to form the portal vein. This is also the superior mesenteric artery, and this one is the whole of this is the body of the pancreas, which is in the triangular shape, has anterior and posterior surface and inferior surface. Along the upper border you can see this artery. This is actually the splenic artery, and this artery arises from the celiac trunk, and this is the common hepatic artery, and this is the celiac trunk. Common hepatic artery also arises from the celiac trunk. These lines in white colors are actually the pancreatic ducts. So this is the main pancreatic duct. This whole of this is the main pancreatic duct, which open in the major duodenal papilla, and this white line which is present above, this is actually the accessory pancreatic duct, which open in the minor duodenal papilla, and the last part is the tail of the pancreas, and tail of the pancreas will end in the hilum of the spleen. So this is the hilum of the spleen, and here it will also cross the lienorenal ligament. Let us cover the OSPE of the large intestine in just 1 minute. This is the appendix, this is the cecum, this is the ascending colon, this is the transverse colon, this is the descending colon, this is this S shape is the sigmoid colon, this is the rectum, and this is the anal canal. These small pouches are called as haustra. All of these will combine to form the large intestine. These pouches, these are called as haustra, and they will combine to form the large intestine. This structure is called as the tinea coli. This is actually the band of the longitudinal muscle, and ascending and descending colon will have the one anterior and two posterior tinea coli, whereas the transverse colon will have the two anterior and one posterior tinea coli. Cecum and the appendix, base of the appendix, these are present in the right iliac fossa. Ascending colon is present will extend from the right iliac fossa to the right hypochondrium and is present in the right lumbar. Transverse colon will extend from the right hypochondrium to the left hypochondrium, or from the right colic flexor to the left colic flexor, and descending colon will extend from the left hypochondrium to the pelvic brim in the left lumbar, and sigmoid colon will continue from the left lumbar, and then we will have the rectum and the anal canal. Anal canal will be present in the perineum. Beside this is the part of the small intestine, which we call it as the ileum, and it will open into the cecum. And if we open the cecum, we will see that there will be the opening of the cecum through the ileocecal valve. The appendix, cecum, ascending colon, and the right 2/3 of the transverse colon is supplied by the superior mesenteric artery, whereas the left 1/3, descending colon, sigmoid colon, rectum, and the anal canal will be supplied by the inferior mesenteric artery. Let us cover the OSPE of the small intestine in just 1 minute. So here the fourth part of the duodenum will be ended. So in this model we will only see the jejunum and the ileum. Actually on the left and the upper side you will see the jejunum. This is whole of this is the jejunum, whereas on the right and the lower side there will be the ileum. This one is the ileum. Ileum actually opens into the cecum, which is the part of the large intestine. This is the part of the large intestine. So if you open the cecum, you will see the two openings. One will be of this ileum, which through the ileocecal wall, and below this one below it there will be the opening for the appendix. Beside this, on the posterior surface you can see the mesentery. The whole of this is the mesentery of the small intestine. Mesentery is actually the peritoneal covering of the small intestine. Remember that the whole of the small intestine is covered with the peritoneum except the duodenum. So whole of the small intestine is mobile except the duodenum. And these are actually the part of the large intestine. So in large intestine you can differentiate between small and large intestine. That the large intestine consists of these tinea coli. This one, whole of this is the tinea coli, which is the band of the longitudinal muscle. Ascending and descending colon will have two posterior and one anterior tinea coli, whereas the transverse colon will have the one anterior and the two anterior and one posterior tinea coli. So you can differentiate between the small intestine and large intestine with the help of these tinea coli. And beside this, these yellow color spots are the epiploic appendages. You can also differentiate with the help of this, because epiploic appendages are not present in the small intestine. And if we talk about the parts of the large intestine, this is the cecum, this is the ascending colon, this is the transverse colon, this is the descending colon, this is the sigmoid colon, and this is the anal canal. Let us cover the anterior abdominal wall muscles in just 1 minute. So this muscle, whole of this is the rectus abdominis. It has the three tendinous insertion. First one is at the xiphoid, at the level of the xiphoid. Second one is at the level of the midpoint between the umbilicus and the xiphoid, and the third tendinous insertion is at the level of the umbilicus. this whitish appearance is actually the rectus sheath, whereas whole of this is the rectus abdominis muscle. This one is the linea alba. It extends from this xiphoid process to the pubic symphysis, whereas this one is actually the linea sibiliaris, and this one is the external oblique muscle. Its fibers are directed downward, and this is the aponeurosis of the external oblique muscle. This is the internal oblique muscle. Its fibers are directed upward. Its fleshy fiber will insert at the 10th, 11th and 12th rib. This one is the pyramidalis muscle. It is a small triangular shaped muscle, and it will actually its origin will be from the iliac crust and will insert it in the linea alba. And this muscle is also the rectus abdominis, whereas this muscle is the transversus abdominis. Its fibers are running in the horizontal direction. Now if we talk about the nerve supply of the rectus abdominis is supplied by the lower 6 thoracic nerves, and its action is the flexion of the trunk and the stabilization of the pelvis. If we talk about the nerve supply of this pyramidalis muscle, it is supplied by the subcostal nerve from the 12th thoracic vertebra, and its action is the stretching of the linea alba. If we talk about the nerve supply of this external oblique, internal oblique, and this one transversus abdominis muscle, these three are combinedly called as oblique muscle, and the nerve supply of the oblique muscle is from the lower 6 thoracic nerves and from iliohypogastric and ilioinguinal nerve from the first lumbar vertebra, and the action of this oblique muscle is rotation of the trunk and the lateral flexion.